emails from people at gas stations saying they're just going to close because they can't sell gas that cheap because they would have bought it at whatever price, right, a while ago, and sell it for 20 cents less a liter.
I literally was like
Holy cow.
$2 in yesterday because I was like, I know what, I know it's gonna drop.
Yeah, that's what I did, but I put 20 in, but
So
I
I'm gonna
got
run up to Costco and go tomorrow morning.
yeah, I don't know if I'd go up there.
I got all day.
Okay. I didn't even go to Costco. I'm in the East End. I didn't even go to Costco. Never done it.
Hello?
Okay, so she's here shortly.
Okay. Thank you. Okay.
We're just gonna.
We are live on CBC, so.
We are live at CBC.
Are we close?
Good afternoon, everyone. Thank you all for coming. For your benefit and the benefit of all Newfoundlanders and Labradorians, I'd like to provide a status update on the COVID-19 situation in the province. Currently, we have no confirmed cases. We have tested 62 individuals and 46 have been confirmed negative. For your benefit, I would like to explain the testing process and provide some clarity around self-isolation and quarantine. If persons have traveled outside of the country and are concerned about COVID-19 symptoms, they should self-isolate and call 811 for further direction. 811 may advise you to contact public health with your information. Self-isolation means to stay at home, limit the number of visitors in your home, avoid contact with others, keep your distance, cover your coughs and sneezes, and wash your hands. Based on your symptoms and your travel history, 811 will tell you whether to contact public health. The staff who monitor the line have the most current information available regarding self-isolation, quarantine, and testing. Currently, the volume of 811 has increased substantially, volume of calls, to 811. We are ensuring the health line is resourced to respond to this increase. We have a new intake specialist hired, and the number of lines have been increased. Public Health will follow up with individuals who contacted them to arrange a time to obtain a nasopharyngeal swab. This process may change as the volume of tests increase. Public Health staff have been working tirelessly over the past few days to test those who require it. We appreciate the public's understanding as we work through this unprecedented situation. The swabs collected by Public Health are sent to the Public Health Laboratory here in the province for testing. and those tests are forwarded to the National Microbiology Lab for confirmation. We are in a pandemic situation and public information regarding COVID-19 is evolving. We heard from the Prime Minister and Canada's Chief Public Health Officer this afternoon, and the Government of Canada is advising Canadians to avoid all non-essential travel outside of Canada. And for those arriving from outside of Canada, they've asked to consider self-isolation for 14 days. We are serious about containment of this virus, and the health and safety of Newfoundlanders and Labradorians is our priority. At this time, we are also advising that non-essential gatherings or events of 250 people or more should be cancelled or postponed. To help ensure Newfoundlanders and Labradorians have the most updated information, we have developed a website dedicated to COVID-19. It will go live today. We have also activated the Provincial Emergency Operations Centre. This will support a whole of government response to COVID-19. It will have an email that will be included on our website. We have been working in collaboration with the regional health authorities. Each regional health authority would have their own health emergency plans in place to deal with increased demand. Thank you so much, and I'll take your questions.
Can you say if we're establishing local testing sites in Newfoundland and Labrador?
So that's under discussion, and certainly those are considerations for all of the regional health authorities.
There was a notice from Eastern Health, I believe it was an internal memo that some of the media obtained, and it does suggest there will be one set up at the Waterford Hospital. Is that correct?
So those conversations are still under discussion.
How many cases, sorry, have been tested?
So at the moment, the latest information that I have is 62, but those are, they change, and there's another run on today, so right now as we speak, so those things.
And you've directed the government for Marble Mountain to be closed. Now we're seeing recreation facilities across St. John's as well.
Yes, so we applaud anyone who has taken the initiative to reduce the risk of spread of COVID-19 and to put in social distancing measures.
I guess a lot of people wondering if Marble was closed, if there are any people that were there that are being tested.
No, that's not the reason it was closed.
Other provinces have closed schools for 2 weeks. Is that something Newfoundland is going to do?
That is certainly part of the, the planning process. Other provinces, what we have to remember is that other provinces are taking their spring breaks right now, and that's part of the reason why they have decided to take those measures, because a lot of people will be traveling at this time. So they just felt to reduce the risk of people coming back from travel, if they closed the schools for that two-week period, it would reduce that risk. So we don't have that same setup. Most of our break is around Easter, so those are questions that we will be considering.
What's being done for frontline staff, nurses, and that if we're expecting an increase in patients and in volume of calls to 811, what are we doing?
So the frontline staff have all been educated about how to, deal with a potential case of COVID should it come in, and regional health authorities have certainly have plans in place to deal with all of those questions with regard to, surge capacity and making sure that they have enough staff on hand and all of that.
But annual leave, I think we're hearing, is not to be approved for the next 6 weeks.
So those are operational decisions within the regional health authorities, so I would have to defer to that.
What's your advice for travel outside of the country?
So I would ask anyone who is, ask people to reconsider their travel plans, absolutely, and to not travel outside of the country at this time. I think you are taking a chance, not only with your health, but with maybe not being able to get back, and your 1 week trip could turn into a much longer in an area that may not have the supports that you need. As well, if you get sick in other areas, that could be, you have to consider how you might pay for that, or what the health system is like in those areas, so that's important. But the other thing is, if you do get sick and you come home, not only are you at risk yourself, but you could put those around you who may be more vulnerable and at risk for more severe disease in jeopardy as well.
What do you say to those who are panic buying right now? We're seeing toilet paper flying off the shelves. We're seeing a shortage of hand sanitizer. What do you say to these people that are essentially panic buying?
So we have to remember that there are no cases in Newfoundland at this time, and there's limited transmission in the community in other areas of Canada. So while, I applaud people for wanting to be prepared in the event that they may have to quarantine or isolate themselves, I think we need to be, nobody needs to run out and buy mounds of things at this point. It's okay to consider buying a little bit extra when you go out, making sure that you have any essential medications that you need and that you're not, you have at least a 2-week supply of that on hand. But we're not really preparing for severe,
Has an
restriction.
algorithm been developed to screen for potential cases here?
Yes. So 811 has an algorithm. All of the regional health authorities have algorithms that they've been following from the start.
So we're in the happy situation where we don't have a case. Should we be doing more to keep people from coming in, keep people from leaving?
So I think we have been doing that and advising people not to travel, and certainly we think that will certainly reduce our risks. So I think right now we are responding appropriately to the situation.
ACOA has confirmed that 2 of its employees from this province are also in self-isolation because of that Toronto conference. Are you aware of anyone else that might be in self-isolation after attending that event?
So there are several people who are in self-isolation after that event. And those people have been assessed by public health. They've contacted public health and would have testing done.
And the public health officer in Sudbury, from where that person is from, the person who was tested positive, said that it's very...
Take those businesses where somebody has flu or cold symptoms, has gone home, what precautions should that company be taking?
So public health will engage with that person and do an assessment just to decide what their risk is, and if that person is deemed to have been tested, then we will test. We have to remember that there is an incubation period for these viruses, so you're not going to become symptomatic or be able to spread the disease as soon as you meet somebody who might have it. I think it's prudent that we follow through with our assessment and with the appropriate steps to make sure that.
I guess I'm meaning for their coworkers. If you and I work together and you develop symptoms and you've gone home to self-isolate, what should I be doing? What should my coworkers be doing?
We just recommend that you monitor yourself. If you're not having any symptoms, certainly monitor yourself for any symptoms, and if you have any concerns, to call 811.
Dr. Fitzgerald, I know there are no confirmed cases, but your best guess, in flu season, I know there are people that have flu in late November, December. We don't get a confirmed case usually till well into January, I believe. And your best guess is, does someone out there have the virus, maybe thought it was the flu, stayed home, fought it off, whatever, like they would a flu? Do you think, in your best guess?
That is a question that's difficult to answer. Certainly, people can have very mild symptoms with this disease, but we know right now that travel is the biggest risk, so we've asked people and screened people for that risk factor, but it really, I wouldn't want to make suppositions in that regard.
There's expected to be festivities on George Street tonight. Should that go ahead in your opinion?
I think people have to be very cognizant of the situation, and I think people have to decide, for themselves about risk, but we would recommend that you try to limit your contact with, crowds of people, and put in social distancing measures. Make sure if you're down there, you make sure you wash your hands well, avoid people who are coughing and sneezing, and just try to stay as safe as possible.
What sort of legislative power would the government have to prevent events from happening or facilities from staying open? Is there any extreme measure that the government can take in the event that that's needed?
So our public health legislation does allow those types of things, so there are measures that can be taken in certain situations, but of course we're not there yet, and because we don't have any cases here at the moment, so we're not there yet, but obviously those are all discussions that we have been having as part of our preparations.
Where we don't have a confirmed case here, a lot of people maybe think that we're overreacting when it comes to some of the precautions in place. Your response to them?
This virus is a virus that is new. We're still learning about it, And I think these types of precautions have been found to be helpful in other places, and at this point, I think we have to take every precaution that we can to, and one of those is travel, for example. So, and we know that in areas where there are more people gathering, there's more chance of spreading the disease. So, I think at the moment we're responding appropriately, and hopefully we won't.
Do you think the country is in a peak right now of cases? Do we think that this will slowly, we'll see the cases less frequent, or are we not near that peak yet?
I think we will still see more cases at this point, yes.
Are you still confident Newfoundland will eventually see cases?
Yes, I think we will see cases. I think that will be inevitable just given travel patterns and what we're seeing in other areas, but hopefully with these measures we will see a reduction, or that number will not be as great as what it would be if those measures were not in place.
And Newfoundland has an agreement to provide care for people in St. Pierre and Miquelon, I believe.
Mm-hmm.
And France, of course, has a large number of cases, and there is a lot of travel between France and St. Pierre and Miquelon. Is there a concern that Newfoundland's first cases may come from St. Pierre and Miquelon in France?
So we have been in contact with the French consulate, and you know, those discussions have been ongoing. Eastern Health has agreements with France to look after people from St. Pierre and Miquelon. So, and those people will be screened in the same way as anyone else.
There's been no discussion of preventing people from France, from St. Pierre and Miquelon, from coming to Newfoundland?
No, not at this time.
Anything else like that?
Just to make sure you keep yourself safe, wash your hands really well. If you have a cold, cough or sneeze into your arm or into a tissue, and dispose of the tissue immediately. Stay home if you're sick.
I just have one final question. Can you say how many ICU beds there are in Newfoundland and Labrador?
Yeah, we have, at the moment, we have 96 ICU beds across the province.
Are we moving non-essential surgeries and that right now? Are we putting a pause on them? Are we going ahead as normal right now?
Right now, operations are as normal.
Can you say how many ventilators we have in Newfoundland and Labrador?
156
And they'd be spread across the province.
across the province, yes.
Sorry, more than 60 tested. How many results back? I know you said that at the beginning.
Oh, sorry. 46 have been confirmed negative, so that means the result is back from the National Microbiology Lab. So.
And 62 were tested and came back.
Yes, as of earlier today. Yeah, but again, that changes.
That's the
Twice a
total
day.
is 62.
Pardon me?
The total is 62?
Yes, as of earlier today.
Okay.
The other one's the
And the
number from
44
national.
are the ones that are back and negative.
46.
46, right.
Just to be clear, though, the 62 are all negative as well. They haven't got results back from the
Yes,
national
we
lab?
just have all the tests that we have done in our laboratory here have been negative.
Okay.
Right. Okay. But that's presumptive.
Yes.
Yeah.
Okay.
Okay. Thank you very much, everyone.
Thank you.
Cheers. Thank you.
I apologize for the lateness of this event tonight. Trying to pull this information is fluid all the time, but we're trying to establish with Dr. Fitzgerald designated time of the day we can do this. So based on our calendar, she's constantly on calls with the World Health Organization and you name it. So we've got to try to find a time when she can actually come out and do this. And you guys know every day what time to show off kind of thing.
Yeah, no, I know we're just
Oh, that's
trying to
fine.
figure out resources, and I don't mean to
Yeah.
bug you. And
No,
but we're
we
just,
appreciate it. We
trying to
appreciate
figure out
it.
times as well.
There could possibly be, but we'll send it advisories. Yeah.
So we don't know yet.
No, I mean, I know I have to work Saturday and